Muslim women today has struggled a lot through life, whether it's career, study, family responsibility, office environment, marriage, friendship, situationship, and they are facing with peer pressure, social media pressure, trying to fit social standard, feeling left behind, insecurities, having problems setting boundaries, had no one to talk, fear of being judged, and the list never ends. Assalamualaikum, inspiring ladies. Welcome to You Are Blooming channel. I am Mastura, a self-help author and entrepreneur, and I help single Muslimah secretly for years. I've been through 20 years of harsh journey to be a high-value Muslimah, and this is my secret love letters to you. Now let's talk about our topic today. For the past few weeks ago, I attended conferences about mental health affects women's overall health, as well as the journey of how women are strong internally and never give up from the Islamic perspective. Both conferences proves a clear faith sensitive and evidence look at why mental health awareness is crucial for Muslim women, including real factors, challenges, solutions, and Islamic perspective of it for each of the problem. This actually triggers me to sign up course about mental health, psychology, counseling from Islamic perspective. Well, I'm not an expert yet, of course, but I'm sharing this as part of my learning process. Increasing mental health issues among Muslim women with simple statistics. Although comprehensive global stats specific to Muslim women are limited, available research highlight alarmingly high prevalence and stigma. In UK community survey, three-quarters of Muslim women reported having experienced mental health challenges, though many were hesitant to name conditions like depression due to stigma. Globally, in Muslim majority contexts, women are more likely to struggle with anxiety, depression, and emotional distress than men. This shows that we can't afford silence on mental well-being, especially when Muslim women are often invisible in research and support services. They are tend to hold and fear of not being vulnerable to tell about their own problems. Now let's talk about some common cases and causes of mental health challenges Muslim women face for both general and unique stresses. Some of common psychological conditions can be anxiety, chronic stress, depressions, severe depressions, emotional burnout, self-isolation, identity struggles, stigma, fear of judgment, and one study focused on Muslim women. 75% experience depressive symptoms, including anxiety attacks, due to self worth and even suicidal thoughts. Some of the root causes found are social and cultural pressures. For example, expectations around marriage, family roles, honor, community image can be intense and emotionally straining and draining. Stigma and silence many Muslim women feel they must suffer quietly because of fears of being seen as spiritually weak, drawing criticism rather than support. For the one who live in non-Muslim country, they face discrimination and Islamophobia towards women who visibly practice Islam, such as wearing hijabs and covering awrat, may experience discrimination, which research links to this to the increased anxiety, isolation, and distress. And I had to admit that some cultural or family culture assumptions they have looked down on women who are trying to seek for professional help. Social media pressure to appear perfect and they feel compared to the one shows on the perfect life in social media. keep comparing, and sometimes they face cyberbullying due to not having a flawless life, and they feel so distressed for not achieving the kind of aesthetic life they have seen on social media. This is why spreading awareness and giving emotional support in terms of mental health to Muslim women are very important, crucial for them to feel safe and to be free, vulnerable, and have a better well being. Prioritizing our health is very important as and the first step to overcome this problem. And for any coping mechanism, it should be faith aligned conversation, mental well being as overall health, and not of lack of iman. There's lack of iman and mental health is definitely two different things. One must be very selective in seeking help. And they must filter who are the one they can truly have a safe space for support groups, and where they feel that their emotions can be validated, and of course seeking help through dua and trust and tawakkul to Allah is the main thing for uh, we as a Muslim woman. Mental health care needs can be both spiritual and physical or practical tools. Strengthen spiritual resilience through dhikr, dua, consistent prayer for inner peace, and of course, build healthy lifestyle habits, proper sleep, seeking a professional and small circle for better support. Get a professional therapist, especially if you're dealing with this problem. Islam encourages using appropriate remedies, and professionals are part of it. However, my dear inspiring Muslimah, we ourselves must be able to detach from the things that distract us, from the things that might affect our mental health. Focus on our growth. Let go of all the gossips or anything on the social media that might trigger your emotions and mental disturbance. It is not easy to say and easy said and done, but keep dua. I hope you can heal and feel better soon. Assalamualaikum, and share this with your friends. Feel free to subscribe and share your thoughts down below.